It's a real privilege to be here tonight, and it feels like I'm here in substitute for Mrs. Ford because she's not able to travel anymore. Last week she turned 90, and physically she's struggling but not doing too bad. Emotionally, ever since President Ford died, has been a struggle for her, as it would be for any of us. And she misses him. She says to me quite often, she'll say, "It doesn't seem right that President Ford's in Michigan," because of course he's buried at Grand Rapids at the museum, and I'm here in California. And so I'll remind her that that's just his body, that he's really right there next to her. And then we'll share stories, which, as you all know, is a good thing to do when we're both mourning but celebrating the life of the people we love. Recently, I reminded her how often she would call me about 4 o'clock in the afternoon and say, "John, why don't you come over to the house so we can talk?" And the first thing I would do before I'd go out and get in my car, the Betty Ford Center is about a half mile from where the Fords live, is to call my wife and say, "I won't be home for dinner." And because we raised 3 children in California, and I wanted to make sure the kids got dinner. And I'd go over and we'd be working in their den, and Mrs. Ford would always sit on the couch and I would sit on the chair to the side. And invariably about 10 after 5, we'd hear some steps, and President Ford would have come over from the presidential office into the home and was coming into the den, and I would always stand up quickly, and say, "Hello, Mr. President." And before I'd get halfway up, he'd say, "Don't stand up." It was just a ritual. And he'd come in and say, "Now, I'm not going to bother you. Don't even pay attention that I'm here. I just want to watch the local news." And so he'd sit down and use his remote. And in the later years, when as cable television gets more complicated, and there'd be 4 or 5 remotes, of course, Mrs. Ford would have to get up and show him which one to use. But in the early years, he would turn on the local channel, and Mrs. Ford would say, "Now, turn it down. John and I are working over here." And he'd turn it down low. And we'd be working on something, and within the first 10 minutes, and this happened, it was just like a routine from a comedy show. Within 10 minutes, we'd be talking about something, and he would turn around and go, "I'm not sure about that," and point right at Mrs. Ford, and Mrs. Ford would say, "Honey, we're doing business over here. You watch the news." And it would be a little routine that we would go through, and I reminded her of that just last week, and I try to share those stories with her because you got to hold on to those stories. It's a way to celebrate everything that's happened. Mrs. Ford is so honored that the library is honoring her, and I told Elaine that before I flew out here yesterday, Mrs. Ford called me and told me to behave, and so Elaine's probably going to be giving her a report. I'm not sure. I went to the Betty Ford Center in March of 1982. We opened our doors in October, so I was very privileged to help Mrs. Ford begin the process and hire the original staff and really set the protocols and the criteria that we used as we opened the center that October. But there were a lot of things that we went through even prior to that opening, and some things that President and Mrs. Ford went through prior, obviously, to me getting there. In 1978, and again, reminding you of the history, January 1977, Jimmy Carter was inaugurated president, and the Fords had chosen to build a home in Rancho Mirage. The reason for their decision, more than anything else, was one, a very close friend of theirs, Ambassador Leonard Firestone, had offered them some land next to him, and they had become good friends with him. And 2, Mrs. Ford was bothered by arthritis, and so she felt the dry climate would be helpful to her in dealing with her arthritis. So they built a home in Rancho Mirage and moved there. Well, as you expect from a former president, President Ford immediately had all sorts of things to do, all sorts of speaking engagements, was traveling all over the world. And Mrs. Ford was there finishing their home and moving the furniture and getting ready for things, and was drinking alcohol as she liked to do and mixing it with pills that she was taking because of her neck pain from her arthritis. It was very clear that she was getting more and more impaired from the combination of pills and alcohol. And in April of 1978, her 4 children and her husband decided to do an intervention, what we call a formal intervention, when you ask an intervention specialist or counselor to help you do it. So the children all arrived to the home, and unsuspecting to Mrs. Ford, gathered together, and as interventions go, confronted her with a lot of tough love and said, you know, basically, Mom, we don't want to see you continue to go downhill. We think that you need help. The normal reaction of men and women when they're put in that situation is, one, to get very angry, one, to feel like our family's putting us into a corner and there's nothing, you know, it's very difficult for us to get out of that corner. And that happened to Mrs. Ford. She was very angry at first, but then she agreed to go for help. And a few weeks later was admitted to Long Beach Naval Hospital for treatment of alcoholism and pill addiction. That's all documented. She's talked about it many times. Interesting story that has a direct relationship with the Betty Ford Center was a Saturday morning that Mrs. Ford was admitted to Long Beach Naval. She filled out the forms, the papers, and was taken by a nurse to her room. They opened the door to the room, and Mrs. Ford looked, there were 4 beds in the room. And again, this was not even a year and a half from the time she lived in the White House. And Mrs. Ford turned to the nurse and said, you know, there must be a mistake. I specifically said I have to have a private room. And the nurse very smartly said, Mrs. Ford, let me contact the other 3 ladies and see if we can move them to a different room. Mrs. Ford said, no, just have them stay right here, I'll be fine. Well, when we built the Betty Ford Center, each of our inpatient units has a 4-bed room in it. And so when the patients complain, I say to them, don't tell me about it, tell Mrs. Ford, you know, but that's where she spent her treatment, in a 4-bed room. She came back to the desert after her treatment, got very involved in her own recovery and in other activities. And she and her very good friend, Ambassador Leonard Firestone, who was also a recovering alcoholic, began to see the desert and that environment, the mountains, the climate, the quiet as compared to a large city like Los Angeles, which is about 100 miles west of us, would make a great place for a treatment center. President Ford got involved, and in 1981 got a new law passed in the state of California, creating a category of hospital for addiction. So it was a hospital license, but a hospital to do only one thing, to treat alcoholism and drug addiction. Ground was broken then in 1981. This is a picture again of Ambassador Firestone and Mrs. Ford. And this is while we're building the place, and I'll show you the ground in just a minute. This is a great picture that I put in here because I like it. This is President Ford, as you can see, pointing out things to Ambassador Firestone next to him and to Bob Hope, who, as you know, was one of President Ford's favorite golfing partners. They played a lot of golf, and he was there to celebrate that. That's the actual picture of the groundbreaking that, again, was in October of 1981. We sit on 20 acres on the back side of a campus of Eisenhower Medical Center. It's a well-known medical center in Rancho Mirage that was named with the permission of former President Eisenhower, who came to the desert after he left the White House because he liked to play golf and spent a lot of time out there. So 1981 we broke ground, and then, as I mentioned earlier, in 1982 opened our doors to begin taking patients. Mrs. Ford's vision, Mrs. Ford's dream really played out in how the place was built, how it opened, and what I mean by that is a lot of things. One's the environment. How do you create a healing environment? You know, hospitals and healthcare institutions are always struggling with that. How do we create the environment that is safe for patients, safe for staff, and all that the word safety means, much more than just physical safe. With a disease like alcoholism and drug addiction, how do you create a place that's going to help people to feel like it's okay to ask for help? Still today in 2008, there's an incredible stigma for any man or woman who is dealing with addictive disease, or any of us who love someone in our family or a loved one who's dealing with this disease. Mrs. Ford, I believe history will say, has done more to break that stigma down than anyone, but it still exists. And so she knew she had to have a special place that would help reduce that stigma as much as possible. How do we help people feel at home and feel the love from the minute they walk in? Mrs. Ford's vision was we would probably be a Southern California regional center, being that the population in LA and Orange County is so huge. She underestimated the impact of a woman who was so admired opening up a center, because almost from day one, patients came from all over the world. When you look over our 26 years of statistics, about 40% of the patients come from the state of California. About 55% come from the other 49 states, and then just under 5% come from outside the United States. We're obviously the best known program in the world. When we've done studies that measure the impact of your name, how many people know the name, branding studies, for example, we usually score between 93 and 95% that know the name. And you all know what Coca-Cola and companies like that have paid to have that kind of branding. Well, I can tell you in 26 years, our advertising budget has been zero. Our advertising budget is Mrs. Ford, because she's the example. Many, many people come to the door saying, if that woman could do it, Mrs. Ford, then I can do it. And she's been a model like that. She often reflected on how can this be a special place for women. Traditionally, in addiction treatment, women are very underserved. It's not unusual in an addiction treatment center that you'll have 3 men for every 1 woman, 4 men for every one, 2 for every one. That's very usual. While Mrs. Ford said, we're not going to do that. What are the obstacles that get in the way of women asking for help? And we're going to try our best to break those down, make this an accessible place for women. To her great joy, since the day we opened, 50% of our patients have been women. And I give her total credit for that. In 1988, 20 years ago, we chose to go gender specific. So men and women are treated in separate halls, in separate groups. We think it works better with addictive disease. She was, again, the trendsetter. She wanted that. She had a vision for that. Family treatment. People told Mrs. Ford and I, yes, addiction is a family disease, but open up your center, get it going, then you can start working with families. Well, to her credit, Mrs. Ford said no. Any alcoholic or addict who wants help, who wants to come here, we're going to start working with their loved ones right from the beginning. So we've had a very formal, intensive family program from the day we opened up our doors. So, if your loved one is getting treatment, you're going to be asked to come for a 5-day intensive program to learn about this disease and how it's affected you. We have a very unique children's program. We don't know anybody in the world that's doing this. This is for children from 7 to 12 years of age who live every day of their life affected by addiction, because a mother, a father, an older adult who's key in their life has the disease. It's affecting them. Our studies indicate that children, you can see the effects much like children from divorce. They believe it's their fault. All those things play out. We bring kids those ages in for 4 full days, Thursday, Friday, Saturday, Sunday, so they only miss 2 days of school, and work with them to understand this disease and understand that mom or dad or their brother has this disease and can get well. Mrs. Ford's legacy is these children. We were so excited about the way this worked when we opened it up in California. We have since opened up a children's program in Dallas-Fort Worth for the 4 counties around Dallas, and also in Denver for the counties around Denver. It's the only other 2 places that have the name Betty Ford Center from our center in Rancho Mirage. Interestingly, over the years, there's been about 40 official offers to open up other Betty Ford centers. They all went straight to Mrs. Ford, and they'd say, Mrs. Ford, You know, if you come to Detroit, we'll build the hospital, you run it, and we'll call it Betty Ford Center Detroit. Mrs. Ford said no to every one of those. She felt like you can't franchise that environment that I talked about. So what we've done instead is we go out and work with other programs. So when a program calls us and says, we recently were in a program in Calgary, Alberta. They were having trouble. They didn't think they were as effective as they could be. So I send staff there and we work with them to try to improve what they do. But we don't allow them to use the name Betty Ford Center. Elaine mentioned about her name. She did not want to put her name on this place. As a recovering alcoholic, she would say to President Ford, what if I take a drink? What if I take a drink? You know, the day before her 90th birthday was Mrs. Ford's 30th AA birthday. But that wasn't headlines of any paper. But she often said to our patients and to our staff, if she took one drink, it probably would be in the headlines. Okay? And so she was pretty nervous about putting her name out there. But as Elaine said, President Ford and Ambassador Firestone convinced her that putting her name out there would be like a beacon. It would just say, this is a place of safety. This is a place where you can come to for help. There's so many stories that, as I was thinking about coming here today, that tell you the story of the impact Mrs. Ford has had on people's lives. The slides that we were showing, that Nancy was showing before we started today, a couple of them were, as you all know, within the first year that President Ford took office as president, Mrs. Ford was diagnosed with breast cancer and had a mastectomy and chose to tell the world. Because of the overwhelming positive response to that is why she did the same when she went to Long Beach Naval Hospital for addiction, is to go public and tell the world that she was being treated for alcoholism and pill addiction. The impact that she's had on both those diseases, breast cancer and addiction, is just incredible. She said, you know, ask for help. The rates of mammograms after her 1974 announcement about her breast cancer went off the chart. She's had an incredible impact on both those. But it's amazing some of the stories, how people get around. One of the stories involves one of my daughters. 1986, my oldest daughter was 7, and she was in a Brownie Girl Scout troop. And my wife and another mother were the leaders. And Mrs. Ford and President Ford, as you know, have always been great supporters of the Boy Scouts and Girl Scouts. And Mrs. Ford said, why don't you bring the troop of girls over to the house and I'll say hi to them. So they went over to President and Mrs. Ford's house, and they're out on the front porch, and Mrs. Ford's talking to the girls. And my wife decides to ask these girls, about 12 little girls, you know, do you all know who Mrs. Ford is? And nobody said anything. And finally, in the back of the group of 12, here's my daughter, and my wife's trying not to call her, you know, raising her hand as high as she can. And so finally, my wife had no choice, and she said, well, Rachel. And Rachel said, she's named after the Betty Ford Center. Well, to a 7-year-old, that sounded logical. And Mrs. Ford liked that story so much that when she wrote her book, Glad Awakening, she put that in the book, that little story. Betty Ford Center today is, again, the best-known program in the world. It's very different than most programs, and again, because of what Mrs. Ford did. We have 100 licensed addiction hospital beds. We have another 84 beds that are in some homes that we own in the community, where people in a group of 6 men or 6 women in a 3-bed, 3-bath house live for up to 90 days to continue their treatment. Many of our patients are licensed health professionals, nurses, physicians, dentists, pharmacists who are licensed by their state, pilots licensed by the FAA. When any of those folks are referred to treatment, it's for usually a minimum of 90 days. And then they're monitored usually for 5 years after treatment. So they'll live in those homes, come to the Betty Ford Center for treatment each day, but live in a sober situation in those homes. We have a clinical diagnostic program where professionals and others come for 2.5 days, especially when the person thinks when their loved ones believe they have a problem and need help, and they're just resisting it right up to the nth degree. They say, you know, you're wrong, I don't have the problem. We'll bring a person like that in, and with our addiction psychiatrists, psychologists, counselors, we'll do an evaluation, a very intensive evaluation for 2 to 2.5 days. We have an intensive outpatient program that we've had for all 26 years. Part of the vision for Mrs. Ford, though, is how can we make this affordable for people? Treatment is not inexpensive. She would often say to me over the years, can the school teacher in Nashville, Tennessee afford to come to the center? Now, why she picked on Nashville, I don't know, but that was one of the questions or the measures she would ask. So part of what Mrs. Ford helped us raise was a scholarship fund. We call it a patient assistance fund. Last year we gave $4.5 million away, and this is where a person who desperately wants help, wants to come in, doesn't have the money to pay for treatment, we ask them to come up with something. We found that when you gave it away for free, it often doesn't mean much. So we asked them to come up with something somewhere between $2,000 and $6,000. And if they come up with that, then we'll pay all the rest from our scholarship funds. So about 15% of the men and women who come in are getting scholarship help. So we do a lot of fundraising as a nonprofit hospital. One of the things Mrs. Ford and Mr. Firestone insisted on was that we would never build a building on our campus, and we now have 9 buildings on our 20-acre campus, unless we raise the money first. Their attitude was, once you go into debt, then you're forever going to be paying off the cost of that debt. So we've always gone out and raised the money first. Now that had some interesting angles in the early days, because basically the money in the beginning was just those 2 people going out with their hands out, please help us, to foundations, to friends, to corporations. We had some decisions we had to make. We made a decision not to go to the government for any money, because once you get governmental money, they can come in and tell you how to do things, no question about it. Another group that we had to think long and hard about was the alcohol industry. And you think, well, why would that be a hard decision? We're not against alcohol. We're against alcohol for alcoholics, okay? But every study that's ever been done in the United States says of adults in the United States who drink alcohol, about 1 out of 8, 1 out of 9 will have a problem in their lifetime. So we're not suggesting we go back to prohibition. Okay, we just want that 1 out of 8 to get help. They deserve to get help. But the alcohol industry wanted to give us a lot of money, and especially the beer industry. And we, but then we started thinking, I remember one meeting, Mr. Firestone, Mrs. Ford and I were sitting around, and Mr. Firestone said, you mean one of our halls could be called Coors Hall? And so we decided maybe that wasn't a good idea. So we did not take their money, but it was something we thought about, because we were desperate to raise as much money as we could. This is a picture of the campus shortly after we opened. There were 4 buildings, and up in the toward the mountain is the campus of Eisenhower Medical Center. We're surrounded by mountains. They have snow on them a few months of the year. The other thing you don't hear if you come out as a tourist is the San Andreas Fault also runs right through the area. So down in a mountain range down in here is the fault that runs through, and they keep telling us we're going to have a huge earthquake one day. But and this is a picture of our campus today. Here's some covered parking, but the lake and the buildings, again, there's 9 buildings. I was telling Elaine, I just bought 7 more acres of land for the future. One of the things that Mrs. Ford still has a dream that we can do is to build a building. We created this thing called the Betty Ford Institute, and it's a way for us to go around and train and teach and help others. For example, with medical education, we train medical students throughout the year. By the way we train people, and if any of you are ever interested in this, go to our website. You can get a lot of information about it. We train people by putting them into treatment. So if you're a journalist, if you're a nurse, if you're whatever you want, say, I want more training. I want to go to the Betty Ford Center for training. We put you into treatment as if you're a patient. Now, the other patients know who you are. If Elaine came, we'd say, this is the director of the, President Ford Museum and Library. She's here to learn more about addiction. but she would spend all day from 7 in the morning till 10 at night with the patients on that unit that she's on. When we bring medical students through, there's no better way for them to learn. But we've learned lately there's a huge gap that even in medical schools that train undergrad medical students on it, primary care, especially family practice, pediatrics, and internal medicine, the residency programs, usually 3 or 4 years in length, have almost nothing on addictive disease. So we're bringing together a group of people around the country to figure out how can we change that. How can we create some model programs that could be used at different sites? And that's what our institute's going to do. One of the luxuries, the things that makes my job one that, you know, at times I have to pinch myself that the last 26 years I've worked at the side of this incredible woman. And you can imagine the stories when she and I would be going to a speaking engagement or a television appearance, and we were in the back seat of the Secret Service car. She would often reach over and fix my collar or my tie, and she'd be saying to me as she did this, now I do this for President Ford too, so don't think anything about it. And I would hear the 2 Secret Service agents snickering in the front seat as she did this. The other thing that would happen, my wife loves this one, is at times we'd be places, and one of the rules of Secret Service is they can't hold things. I learned that very early on because patients had some books they wanted her to sign, and Mrs. Ford had been to see me and she was leaving, and I handed these 6 books to one of the agents, and they said, you know, they aren't allowed. So I carried the books out to the car. Well, various places, you know, it'd be myself, Mrs. Ford, and the 2 agents, and Mrs. Ford would be ready to be interviewed or something, and so guess who got to hold her purse? And so my wife loves that. She says, this is the guy that holds her purse. Obviously, that's an honor when it's Mrs. Ford. Some of you know that she and I were honored that 4 times we were on Larry King together. When Larry King wanted Mrs. Ford to come on the first time and talk about the Betty Ford Center, she said, I'll do it only if John's with me. And his people said, fine. And all the way to Los Angeles to the CNN studio, she said, now, you're going to take most of the questions. And I said, Mrs. Ford, they're not going to want to talk to me. I guarantee you, they want to talk to you. And she said, well, I'm going to get those questions to you as fast as I can. She said, I'm going to look for every segue. But ended up that she thought the segue is not enough. So what she would start to do is when she'd get a hard question, she'd start to kick me. And you can't see that, of course, on the camera. And one time she kicked me so hard her shoe came off. And in the studio, we could hear the shoe hit the floor, because when we went to commercial, Larry King said, what was that? But she wanted to make sure I was going to have to take some of those questions, and we had fun doing those shows together. This is President Ford and Mrs. Ford cutting a ribbon on a new building, which they often did. President Ford always took the back seat when it came to the Betty Ford Center. He was always there. He raised money. He was supportive. In the early days, when our board was going to meet and we would look at, you know, one of the things obviously any nonprofit board has to do is look at financial statements, and that was not Mrs. Ford's strength. So she would always ask me before the meeting for an extra copy. She'd give it to President Ford, and within a day or two, I would get a call, and they'd say, John, the office of President Ford's on the phone. And I would get on the phone, and they'd say, John, President Ford wants to talk to you. And he'd be looking at page 6 and say, what's this and what's this? And I knew he was going to, you know, get Mrs. Ford ready for the meeting. But he always did it in the background. They liked to tease each other because Mrs. Ford's title in the early days, my title in the early days was administrator, director, and her title was president. And then they made her chairman and me president. But she would love to start her talks by saying, you know my husband, he's the former president. You know, I'm the president of the Betty Ford Center. And the two of them would smile at each other and had fun with that kind of back and forth. She was the chairman right up to January of 2005 when she asked her daughter Susan to take over, and I'll talk about that in a minute. But she really it wasn't just being the chairman of the board and being the head of the Betty Ford Center. For her, it was a work of love. Much more than going to a board meeting and talking about fundraising or financial statements. What she liked was being with patients. Young or old, she would hang out on the patio. She'd have a glass of iced tea with them. When she'd come for lunch, she'd always be funny. She and President Ford had a tradition of having lunch at 1:30. I don't know where that started, but that's the time they would have lunch. And our patients eat lunch at noon. So she would sneak over and say, John, let's go down to the patient cafeteria. Don't tell my husband now. And we'd go in and we'd have a little lunch. She always sat at a patient's table. That's where she wanted to be. And then she'd go home and not tell President Ford that she'd already had an early lunch. But she wanted to be with the patients. That was what she wanted to do. She was a model for them. And she still is today, even though she's not able to be at the center physically anymore. She's a model for every person that comes in, especially the women who just hold her up as if she can do it, I can do it. And it's wonderful that they do that. She would come every 4 weeks and lecture to all the patients. And we have 2 formal lectures a day as part of a rigorous daily schedule. One's at 8:45 in the morning and one's 6:15 in the evening. She would come and lecture every 4 weeks, so every patient would get to see her. And every time she would come in with her note cards and be scared to death. And I'd say, Mrs. Ford, it doesn't matter what you say. They just want to see you. She says, oh, yes, it does matter. And she would change her remarks and try to improve her speech and get up there, and the patients just loved every minute of it. She traveled around the United States talking about addiction and about recovery. And what was great is she wasn't just helping the Betty Ford Center, she was helping everybody. When she'd go to Cleveland, when she'd go to Ann Arbor, Detroit, wherever, she was helping every center in that state because she was a symbol that you can recover from this disease. And it was a role, this was early days at the center, it was a role that she took and understood, but just like with putting her name on the place, she's not a person that wants to be in the limelight. She would often say to me in private moments, she'd say, John, I don't think people understand that this isn't me. She said, this is God working through me. I'm just the instrument here. And the fact that I was the first lady and that can reach so many people is wonderful. But she said, it's not me. And she believes that. She still believes that today. And one of the things, if you came to the Betty Ford Center and looked at our programs and discovered our programs and compared it to a lot of places that offer treatment for this disease, you'd be surprised how spiritual our approach is. We have a spiritual care staff, interdenominational, and it's a very important part of everything we do. This was early days Mrs. Ford giving a lecture. And again, that was something very important to the patients and important to her. The 20th anniversary of the center, we had a very special fundraiser. One of the things we did right was think we better have a big one for the 20th rather than the 25th, because we were so scared that President and Mrs. Ford were both aging. Thank God we did that. But this was the 20th, and the first ladies came out. Lady Bird was too ill to travel, or she would have been there. Laura Bush sent a video message, but the first ladies were all there. All of them spoke about the impact they felt that Betty had made, both through the breast cancer and through the Betty Ford Center. I truly believe, and I'm biased, there's no question about it, but that history will look at Mrs. Ford's contributions and her impact as a former First Lady and compare it. One of the few people I think it compares to is Eleanor Roosevelt. Now, I'm biased, I admit that. But I think history is going to measure and weigh Mrs. Ford's commitment and the impact she had in an incredible way. President Ford would often say, you're going to be a much bigger hero historically than I will be. And of course that was out of his love, but I think he was very sincere when he said that. So 2005, Mrs. Ford said, it's time. Susan Ford Bales, her daughter, had been on our board for 14 years. She asked her to become chairman. Mrs. Ford stayed on the board as founding chairman. And we also launched the Institute as a way to reach out and try to affect others. And others of all different types. Two of the groups that we're working with through this Institute that gives us great joy. One is a group called the Alkali Lake Band of Indians in northern British Columbia. A tribe of native Canadian that by their own accord had about a 90% rate of addiction in their tribe. And today have 90% recovery. Not because of us, but because of them. We're up there just trying to reinforce and support that, what they're doing up there. And we're now helping them go around to other tribes in both U.S. and Canada. We also are working with the Lakota Sioux, a group in South Dakota. Lakota Sioux came to us. They believe they have the highest rate of addiction of any Native American tribe in the U.S. And they have not been able to make a big dent in it, and they asked if Betty Ford Institute would come in and help them and work with them, and we're trying to do it. We don't know where all that's going to go yet. We don't go in there and lecture and say, here's how we do it at the center. That's the last thing they need. We go in there and try to help them figure out how to be effective and how to reach out to people, and we're partnering with them, and that's the way we're trying to do it. We worked with a group in Mexico to open up a center in Mazatlan, a 40-bed treatment center for Latin America. The wife of the president of Mexico has now asked that group to open up a similar center in Mexico City, and they've come to ask us to help them do it. So hopefully we can keep the impact of Mrs. Ford's dream expanding, by just allowing her dream to play out and supporting, what she stood for. And this is, of course, mother and daughter who are very close as the legacy continues. One of the things that keeps Mrs. Ford going now at the age of 90 is she calls me every day and wants to know what's going on at the center. And it's one of the things that she still can hold on to and think about. Because, as I say, she misses her husband, very, very much. But she loves what's going on at the center, and it's a legacy that hopefully will continue for many, many years. Every person that works at the center, we have about 270 staff. To them, it's not a job. It's many of them will say, "I'm here because of Mrs. Ford. I'm trying to make Mrs. Ford's dream come true." And that's how most of us feel that are there. It's a very special place. We have a great website. It's easy to remember, bettyfordcenter.org, O-R-G. Please visit it. There's a lot of things on there, and some history that much of what I shared with you tonight with Mrs. Ford. Why don't I stop and because I'd love to answer any questions or hear any comments that you had that anybody in the audience would like to talk about tonight. Yes?
I wonder if you could tell us, because this is University Town, if your program has changed due to research-based addiction knowledge that might have come since Mrs. Ford was treated.
The research, and you're totally correct about addictive disease, thank God, has really taken off in the last 10 or 15 years. We now can do, especially for a drug addict, even more than an alcoholic, an MRI and find changes in the brain chemistry that we believe are a result of the addiction. And we believe some of those changes will never go back, okay? And we're learning things like that about the brain that we never knew before. Those are incredible things. We're using new medications. An example, Betty Ford Center was one of the clinical sites for a drug called Buprenorphine that has actually been around a long time, but it was discovered that it might work well to detoxify opiate addicts. Up to that point in time, when an opiate addict would come to the Betty Ford Center, the rate of those men and women going AMA, deciding to take off, was twice that of an alcoholic. With buprenorphine now, their rate of staying and committing to stay is the same as the alcoholic. It's made that much difference. So now if you come in and your drug of choice is an opiate, whether it's a legal opiate like OxyContin or Vicodin, or it's heroin or some drug like that, we're going to detoxify you with buprenorphine. In a period of about 8 to 14 days, our doctors get you off of everything using that, and you're going to then go through the rest of your treatment. It's an incredible advance. With a patient who drug of choice is alcohol, who seems to do well in treatment, goes back home and just continues to relapse, continues to go back to using, then we'll consider using some of the new category of drugs that will help deal with that and seemingly will help avoid some of those relapses. So the research is very important. The research in the early days is what really caused us to think gender-specific treatment works better. And our data since that point has just verified that. So we think it's very important to use the good clinical research that's out there to continue to improve yourself. Yes, her question was about success rate. It is a very hard question because a disease like ours, and ours is a chronic disease like diabetes, arthritis, asthma, chronic pain, there is no cure. So when we talk about success, what are we measuring? With licensed health professionals who come and are monitored for 5 years after they leave, we know exactly how that group does because they get unannounced drug tests over that 5-year period. Licensed health professionals who come to Betty Ford Center for 90 days, over the 5 years after they leave, the number who test positive even one time is less than 15%. Now, the critics always say, yes, but those folks have a gun to their head. They're not going to be able to practice dentistry or medicine anymore if they relapse. We don't think that our long-term recovery rates are 85%. We think they're over 50%, but no one has an exact figure. We keep in touch with people when they leave the center for 1 year through a series of scheduled calls to monitor how they're doing. But as a good researcher will tell us, we know how they're doing by what they're telling us. You don't put that in a research report or, the patient says I'm doing great, here's why, here's what's happening. That's wonderful, but you can't, researchers would yell at me if I said, well, the patients tell me they're doing great. We think people do very well, but we don't have exact success factors. That's a great question because I often tell our own patients, most treatment centers, if you would call them, if you call treatment centers around Detroit or any big city, 8 of the 10 centers, if you ask that question, would give you a percentage. 63% of our patients are clean and sober 1 year later. They don't have the slightest idea. They do that because they think they're supposed to. It's not because they're lying. They think they're supposed to come up with that percentage. No one knows. The best guess is with those license programs for 5 years, but no one really knows is the answer. Someone else, yes?
The mix of professionals who provide treatment at the center, what are type of those people, those professionals, the doctors or psychiatrists or homeopaths or physical therapists or natural treatment? And it's my follow-up to that is that in addition to the chemical treatment by detoxification and stuff like that, is there any experimentation or emphasis by treatment of non-use of chemical methodology? Because that's practiced quite frequently in many cultures, and it has been known to be successful in various ways. And I was kind of curious if this caliber of center would be interested in exploring those ways.
Right. Let me give you a breakdown on our staff. We have physicians who are certified in addiction medicine by the American Society of Addiction Medicine. We have psychiatrists who are addiction psychiatrists, so they have gotten what's called a certificate of added qualification by the APA, the American Psychiatric Association, doctorate psychologists, master's level counselors and therapists, spiritual care counselors, family counselors, nurses. Nurses play a big role at our place. So it's really a multidisciplinary team. Exercise therapists, nutritionists, all play a part in the treatment. We really believe in a holistic approach. We say addiction is a bio-psycho-social spiritual disease. And we think that's where a lot of people go wrong in the treatment of it. You have to deal with each of those dimensions to truly treat the disease. So we'll use whatever works. We use a lot of biofeedback. We use acupuncture. Okay? We use what's going to work. So we try to keep our minds open to whatever's going to work with that man or woman that's in. And we'll bring professionals in who are trained to work with them. We do a lot of yoga, a lot of progressive relaxation. How am I going to deal with stress? Okay, you're teaching me that I can't use alcohol and drugs. How am I going to deal with the stress in my life? We have to deal with things that basic to help people get through. About 2/3 of the patients come in have to be detoxified or withdrawn from the drug they're on, and then most people go through the rest of treatment drug-free. So we have to help them figure out, how am I going to deal with the ups and downs in my life, the good days and the bad days? How am I going to deal with pain? I know I can't take pain medications. How am I going to deal with pain? So we partner with pain clinics who are looking for non-medication ways to deal with pain. And we look for those kind of partners.
What is the age distribution or age range of the people who are patients?
We're licensed to take anybody 18 and older. We're careful with people from 18 to 21 to make sure they're going to fit into an adult program, because ours is an adult program. Often you'll get a 19-year-old who's been using drugs since they were 12 who would fit much better in a young people's program, so we really carefully look at that. Our oldest patient has been 86. The average age is about 45, but it's a little misleading because you get people from all those age groups. And we really try to look for differences. The man or woman who's 73 is going to have different issues than the person who's 37, and you got to focus on that.
To what extent does insurance coverage handle any of this, particularly for older people who say might be eligible for Medicare?
Medicare is the only government program Mrs. Ford and I did try to get to cover us because of our hospital license. Medicare turned us down because we're not a typical hospital. We don't have an emergency room, we don't have surgery, so they refused to cover us. Now, interesting, the insurance thing is a very sad story. The first half of our 26 years, many of the people that came for treatment were referred directly by their employers. Most of the corporations across this country had very active, what they called employee assistance programs. And they would refer people for treatment and through their insurance pay the major portion of that treatment. So we'd get people from IBM, General Motors, Chevron, McDonnell Douglas, all had huge programs. And then they all walked away from the table. One of the points that reminds me, you all remember when, I think it was Chrysler, came out and said that for every car they built, the cost of health benefits for their employees added $2,000 or $3,000 per car. I mean, it was like the shot heard around the world for us. Well, what CEOs discovered, whether they had 100 employees or 100,000, is I can't stop fixing my employees' broken arms. I got to pay for that. I can't stop paying for childbirth. What I can stop paying for is mental health and drugs and alcohol. And they all walked away. I mean, one month I'd be in a committee of the United States Senate testifying on how well treatment worked. I had a representative from Chevron on one side of me and Boeing on the other side talking about how effective their programs were. And 2 months later, they weren't covering treatment. What insurance did, because they're just doing what the corporations tell them, is decide we're only going to pay for detox, or we're only going to pay for 5 days of treatment. And so they all walked away from the table. The only thing that's going to change that is when you and me, common citizens, say, this isn't right. And that's why, you know, it's interesting in the presidential debates when you always hear about 47 million uninsured in the United States. That's not the issue. Any of you that work in healthcare know that. That's not the issue. The issue is access to care. I can have insurance and still not be able to access care. And no one's talking about that. But thank you for asking that question. Yes?
Do you sponsor any studies, any research studies that you ultimately will get to use the results?
We do. We've partnered with probably the leading research group in this field. It's called the Treatment Research Institute. It's affiliated with the University of Pennsylvania. It's based in Philadelphia. And again, you can look that one up. They have a great website too, but they're really for clinical research, treatment research, the best that there is. And so we've partnered with them, and we're beginning now to publish things with TRI. Yes?
What were your credentials or background to have this position?
For myself, well, it's interesting. I was studying for a master's degree in psychology, and we had to do an internship as part of that master's degree. And I got assigned, this was now in the late 60s. I was in Illinois, that's where I grew up, and I was assigned to a state hospital in Rockford, Illinois. And the psychiatrist that a few of us were assigned to, as we'd go through the state hospital, when he would take us to the alcoholic unit, he'd say, a few of these patients get well. And when we go to the mental illness units, it was a little bit bleaker. That was before we had a lot of medications for schizophrenia or depression or any of that, of course. And I thought to myself, if I'm going to work in the helping profession, I want to at least see a few people get well. So I got out with my master's degree, started working, as Elaine said, in a Skid Row treatment center. I learned more than I had learned in all my schooling. I was working at night for a PhD, and I had a man come to me. You know, I love this concept of mentors, and I had some great mentors. And he said, John, what are you getting a PhD for? He said, I thought you wanted to work with alcoholics and addicts, and I thought you wanted to help direct programs. He said, let me ask you something. Have you ever had an economics class or a accounting class or a management class? I said, and I, that day, got into an MBA program and went and got an MBA along. So I was very fortunate. So I can sit and read a financial statement, but I got the psychology side too. So I really thank that man who took me aside and said, what are you doing? And we all need those kind of mentors in our life, I think. So, yes, sir.
I work for a local treatment center here in town, and I can really appreciate everything you brought to our attention. But one of the things that I can appreciate also is how important the recovery community is here in Ann Arbor when it comes to our patients and supporting them and getting involved in some sort of 12-step program. How important is that to the Betty Ford Clinic, and do you encourage the recovery community to come in and like sponsor or support your clients?
The 12 steps are the core of our program. Okay, they always have been. And we basically ask patients when they leave the center, we talk about 90 meetings in 90 days, and we explain to them what we mean by that. We don't just use that as a cliche. Here's what we mean by that, okay? And here's what we mean by a temporary sponsor. And here's what we think you've got to do before you're ready to ask somebody to be a sponsor, and what that means, and what it means to have a home group. We have a very strong alumni association that supports all that and plays that. We actually have 50 chapters across the United States. And it's just alumni stuff. It's just people supporting new folks coming back to those communities, taking them to meetings, getting them used to what that's like. You know, one of the things we say to patients is, even if you've been here 90 days, nothing you've done at the Betty Ford Center is going to keep you clean and sober for even 24 hours. When I first started saying that to patients, staff would look at me like, John, what do you, and then you think about it. It's the truth, okay? What's going to keep you clean and sober is, now what are you going to do about it? You've learned all these things. How are you going to put it into practice? Well, the way is through my 12 steps and getting involved in that. Part of our research that we've learned, and it's part of what we work in this woman's question in the back with the Treatment Research Institute, is, at least for our patient population, if 6 months after discharge, a patient has a sponsor, we almost never need to call them again. The correlation with that and how they're doing is almost off the chart. And we share that with, we say, here's our data. Look what it says to you. What are you going to do about that?
About the buprenorphine, the opiate clients, now you kind of like wean them off, or is that a maintenance program after they leave, or before they leave they're completely free of that particular
Well,
drug maintenance program?
No,
Because
great
that too
question,
could be
'cause-
addictive or habit-forming too as well for some.
because we know over the years, methadone maintenance has been one of the ways people have chosen to deal with opiate addiction. Some folks have chosen to use buprenorphine to replace methadone as a maintenance drug. We choose to use it to detox people and get them off. So they're off the buprenorphine, off the opiates altogether. But we know some people are having some success using it as a maintenance drug. We just don't do that in our place.
For how long do they keep a sponsor? Or how-
Hopefully, if someone's really working the program, they're going to have a sponsor the rest of their life. And then what happens, once you get some time behind you, you begin to sponsor new people.
Right.
And that's part of, I've learned how this is going to work for me. Now I give it away to others, and I reach out and help others. So not only would I have a sponsor, I would be sponsoring new people. So that's the rest of their life. One of the men, that one slide I showed you of President and Mrs. Ford cutting that ribbon, that there were 5 people in, I was going to mention this earlier, but the man in the middle was our original medical director. Very interesting, Dr. James West. In 1950, he was on the team at Cook County Hospital that did the first kidney transplant in the history of the world. He got clean and sober himself in 52. So he's been going to meetings. He's 94 years old now. He's been going to meetings, 12-step meetings, since 1952. He still has a sponsor all these years later. And he would tell you that, thank God he does. So it's a lifelong program.
How many patients are there, generally speaking?
On any given day, I mentioned about 180 that are living there, and then 40 or 50 that are going through some form of outpatient. And again, most of them arrive at the airport. Most of them come, obviously, from out of town to come in. Great questions.
Do you treat other types of addictions? Let's say for someone that's addicted to, I'm thinking of like they're compulsive about just buying something. Do you treat that kind of an addiction, or does it have to be alcohol or a drug?
There are many other conditions that come into play here. What we do, if it's a secondary condition, a good example is an eating disorder. If it's a secondary condition that we think is going to be improved just by the person getting clean and sober from alcohol and drugs, we'll address it. We'll try to help the patient. If it's a primary issue, then we're going to send them to an eating disorder clinic. Depression. Many of our patients have been diagnosed with depressive disorders. Once they get off of drugs and alcohol, for many people, that becomes not as big an issue, or it was misdiagnosed. If it's clear that this person has a primary issue with depression that's every bit as important as their addiction to drugs, we're going to get them to a place to deal with that. We're not a psychiatric hospital. So, great questions. I really appreciate you all being here tonight. Thank you.